My presentation is going to be in the form of a dialogue, and I'll introduce my guests in a moment. Just as a matter of introduction, to contextualize my paper, the 2030 Sustainable Development Agenda will later this year be adopted at the headquarters of the United Nations. And the priority of the new SDG agenda will continue to be poverty and focus on hunger, bringing an end to hunger. And that obviously is underpinned by a lot of inequalities. And the focus of the new SDG agenda for the next 15 years, which will be the developmental agenda of the world, links with people. It's about people, for people, designed by people, and a call to everyone, all sectors, also civil society, to make a difference in the next 15 years. Now, social workers are at the forefront of people who are vulnerable, who face hardships in communities, as individuals and as families. And therefore, we have to have a pathway that can actually address people and social issues on that level. And developmental social work, adopted in the 1997, is that pathway. We focus on the integration of social and economic development. And I have with me, representing the Future Families organization. So I'm going to demonstrate in practice for you what developmental social work is all about. And in the end, just have a wrap up from our dialogue. So I've got two pennies on the front here with me. Penny Massier, she is the social auxiliary worker in Future Families, and then Penny Leermans, who is the CEO of the organization. We'll be running some photos in the background, not necessarily in the same sequence, but just to give some evidence in terms of what we are talking about. Thank you. Welcome. Penny, a few years ago, you received a death sentence. You chose to stand up and you met Future Families. Just tell us briefly your story.
Okay, afternoon everyone. Yes, it's true. It's almost 19 years ago whereby I was hospitalized because I had diabetes. And then I was also tested and diagnosed to be HIV positive without my consent. Then, because it was something that no one would just talk about it so easily, and I was even given a time frame to live because they said I had 3 months to live. So for me, I got so devastated, and I thought, rather than excuse myself from the hospitals and just go and die in front of my family, if that is possible, if I'm dying. But 3 months passed away, then nothing happened. Then after 8 months, because of the stress that I have been in, I started showing some symptoms of flu, and I was a bit frail, and yeah, I even got pregnant. Whilst I was on the process of knowing exactly what HIV is. Then I gave birth to a healthy baby in 2000. She's 15 this year, and she was tested HIV negative because I gave birth through C-section. Then in 2001, I met Future Families, where I met Penny. Future Families, then it was a support group for people that are living with HIV and AIDS. Then for me, yes, I had to learn more about the disease and on how to take care of my health. And also, we engage ourselves into income generating projects where we did big work, and then we could be able to be financially sustained. And we will also be helped to know when and how to take our antiretrovirals. And for me, the support group helped me a lot because I really took my antiretrovirals after 14 years being diagnosed to be HIV positive. And in the process of me exiting from the support group, I got a leadership to study a social auxiliary from the same Future Families NGO, and it also gave me an opportunity to travel abroad to Washington just to educate other people about HIV and AIDS, just to give my own story to other people in the other countries. So it showed me that it was not a death sentence, in fact, to be HIV positive, because today I'm a proud mom of 4 beautiful children, and I'm happy, I'm employed.
So from a victim to a survivor.
I'm no longer a victim, in fact, I'm a survivor.
Wonderful. We have been introducing some of the services of Future Families, so perhaps you can just elaborate and say how you focus specifically also on sustainability as an NGO.
I think a little bit of the background. It was in light of Penny's story that Future Families exists. Today we work with 10,000 orphans and vulnerable children in Tswane alone, and the traditional methods of social work don't cut it. I can't reach 10,000 children if I'm going to have one social worker to 100 children. So we developed an innovative model using community mobilization. We have a massive staff on the ground that visit every family twice a month. We render a planned process to each family, and linked to that, each child has a care plan. We have a plan for every family that we're working with. They're involved in various activities. But maybe more important is that we are listening. We're listening to what those families out there are saying. What are the needs of those children? What are the needs of those moms, those grannies who are raising their children? And this led us to another exciting chapter, and that is work with refugees and asylum seekers that emerged at the time of the xenophobic attacks, where the families are saying to us, "You go help us more." So at present we funded through USAID, through the United Nations High Commission for Refugees and the local government. And really we've got to look at not just psychosocial support. Families need more than that today. We could help Penny feel good about herself, but it doesn't put food on the table. And so we have a really holistic approach to our sustainability as an organisation and to ensuring the families we are working with can be economically sustainable.
Taking it further from there, what opportunities are there for the communities, for the people, in terms of food security, their health, improving their health status, tackling their poverty issues, their education? So what is there and how does the people grab those opportunities within the organisation?
Yes, the organization is engaging the community also just to be part of Future Families, because we have HIV prevention programs. For one, I can give an example that is a peer education. It's a peer-led program whereby we educate or just give insight to the officers on how to take care of themselves and to plan for their own future, and also how to combat on the peer pressure that is everywhere now in our country. And we also have other programs that we do for parenting skills for the parents also, so that they can be able to motivate their children to remain in school, and also for us as Future Family staff to be able to focus on helping these children, especially girl children, so that they can be able to be self-sustainable and also independent, and so that they can also be become victims, but become survivors also in our country.
Right. Penny, and we know also that for food security, and I've seen those with my own eyes in the smallest spaces, that people plant and they eat and they sell. Just in a nutshell, tell us about that.
Okay, we have at Future Families 600 gardens, and out of that 600 gardens in all our sites, 10% of those gardens, families are eating out of it, and they also share with their neighbors. And 15% out of that, they also eat out of it, but also sustain themselves and in making businesses out of those vegetable gardens that they have.
Now, if we can link on that, Penny, is that your organisation used this opportunity and from a social entrepreneurship and a business league to the NGO. Tell us about that.
We have two companies. We have Future Families NPO, and then we have Future Families Enterprise, which is PTY Limited. Then we're training on that social work at university. One of the things we are doing is Saboko, and you can see the picture up on the board at the moment. It's casting compost, and spring is in the air, so we're all putting compost on our gardens. So we decided to make top-class compost and to maybe link it together. The compost is made on our one office site, which is at Ford Motor Company. Ford Motor Company took us in 2001. We've never paid rent, we've never paid electricity, we never paid maintenance, the roof blew off, they put on a new roof. Then we said we want to make compost. They said, yes, we can do it on their premises. We make our compost there. We created jobs for HIV positive men through the compost. We're now selling the compost at Chamberlain's Hardware in Pretoria and all their branches. We supply the vegetable gardens in the community as well. So it's becoming, again, a holistic approach. So we look into our long-term sustainability through such activity.
Okay, but this is also, you spoke about partnerships. So let's tell us about our own partnerships with our engineers.
Up top there, a lot of your students have to do, I'm sure you're aware, have to do community work. The engineering students, I think they put up so many jungle gyms across the city. We're looking for something different. We said come and make a sieve, because we have to sieve our compost. And they made that beautiful electric sieve there and won the award for the best community work project amongst all the students.
Okay, one of the strengths that you have in organizations that you build capacity within, starting from a childcare worker, a team worker, a auxiliary worker, and some become social workers. So you grow, and therefore also you develop business skills and opportunities. Just tell us briefly about that.
Okay, we have a number of projects going as well. It's always the one I just mentioned up there. People love to hear of NGOs old clothes. And so we had a look at what can we do with old clothes. We can give them to the poor, which is really undignified and creates dependency. So now instead of doing that, let's try it a different way. So we take the second-hand clothes, we wash them, repair them, make sure they're in good condition. We train mainly women, I don't know why the men in the group can help me, mainly women, in entrepreneurial skills. They buy the second-hand clothes from us. We charge a minimum amount per item. So again, that's bringing in an income for us. And then we equip them to go out and start small businesses, selling second-hand clothes. We have one woman we're very proud of. She, and I promise you it's true, she generates an income for herself of 15,000 Rand a month, selling second-hand clothes. So again, we're not encouraging dependency. This is about how you become an independent adult in society. She can tell you where every pension point is across the city, what day they're there, when she needs to be there. She has customers, she knows her customers, she runs a business.
Right. Penny, let's move into the wrapping up phase. What is your vision for a better future from in the communities, for the society, to make sure that we all work towards that goal?
I believe in empowering families to create their own future, especially, as I've said, girl children, not that I'm excluding boys, but in a sense of making them aware of how important and how self-worth are they, because I come also from a single-headed household, whereby I never thought education was that important for me. But I believe if girl children would be given a chance to prove themselves in the academic world, then they can become better people in our communities.
Thank you. And Penny, from an organizational perspective?
I think for me, the success in what we do and where we need to go is to take Penny as an example. She came as a client. We helped her understand her disease, of how to live a positive life, gave her an education, and today she can sit here as a colleague. That's successful.
So giving people hope in the future. And that's why you're also a very good link for us with theory and practice. If I can wrap up, what is developmental social work in terms of a pathway is that it's human rights based, but you can have human rights, but without respecting human dignity. And that is a core focus, social inclusion, building capacity, and making sure that justice is for all. Thank you.